Warts and verrucas are common skin growths caused by the human papillomavirus HPV. Though they are typically harmless, they can be unsightly and, in some cases, cause discomfort. Both warts and verrucas are types of cutaneous papillomas, which result from HPV infection in the skin's outer layer. Warts are small, rough growths that can appear on any part of the body. They are most often found on the hands, fingers, and elbows, but they can develop anywhere. Types of warts. Common warts. These are the most typical type of wart, usually found on the fingers, hands, and elbows. They are rough, raised, and have a characteristic cauliflower-like appearance. Flat warts. These are smaller, smoother, and often appear in clusters on the face, hands, and legs. They tend to be more numerous than common warts. Filiform warts. These warts are long, thread-like growths that often occur around the face, particularly near the mouth, eyes, or nose. Periannual warts. These warts develop around the nails, often causing pain and affecting nail growth. They can appear on the fingers or toes. Genital warts. These warts appear in the genital and anal regions and are typically caused by specific strains of HPV. They are sexually transmitted and may require medical treatment. Verrucas, also called plantar warts, are a specific type of wart that appear on the soles of the feet. They tend to grow inward due to the pressure from walking or standing, which can make them more painful than regular warts. Characteristics of verrucas. Painful. Verrucas can be painful, particularly when pressure is applied to them, such as when walking or standing. Flat or raised. They may appear flat or raised and are often surrounded by hardened skin callus. Small black dots. Underneath the surface, verrucas often have small black dots, which are tiny blood vessels that have clotted. These dots are a distinctive feature of verrucas. Causes of warts and verrucas. Both warts and verrucas are caused by human papillomavirus HPV, which infects the outer layer of the skin. Different types of HPV cause different kinds of warts. Transmission. HPV spreads through direct skin-to-skin contact, or by contact with surfaces that have been contaminated, such as gym equipment, communal showers, or swimming pools. Infection. When the virus enters the skin, it causes the cells in the outer layer of the skin to multiply rapidly, resulting in the formation of a wart or verruca. Symptoms of warts and verrucas. The main symptoms of warts and verrucas include raised bumps. Warts typically appear as raised, rough growths on the skin. Hard or thickened skin. Verrucas tend to be hard and thickened, particularly on the soles of the feet. Pain. While many warts are painless, verrucas can be painful, especially when walking or standing, due to pressure on the feet. Changes in color. Warts may be lighter or darker than the surrounding skin, and verrucas may have small black dots inside them. Treatment for warts and verrucas. Most warts and verrucas are harmless and often resolve on their own without treatment. However, some people may wish to remove them for cosmetic reasons or because they cause pain. Several treatment options are available. 1. Over-the-counter treatment. Salicylic acid. This is the most common treatment for warts and verrucas. Salicylic acid works by gradually dissolving the wart or verruca. It is available in various forms, such as gels, liquids, and plasters. Cryotherapy. Some over-the-counter treatments involve freezing the wart with liquid nitrogen or a freezing spray to remove it. This can also be done in a healthcare setting. Duct tape. Anecdotal evidence suggests that covering warts with duct tape may help them go away, though this method has mixed results and is generally not recommended for verrucas. 2. Prescription treatment. Stronger cryotherapy. For persistent warts, a healthcare provider may use stronger cryotherapy, freezing with liquid nitrogen to remove them. Cantharidin. The substance that causes the skin under the wart to blister, lifting the wart off the skin. This treatment is often used for warts on children. Immunotherapy. In cases of widespread or persistent warts, immunotherapy may be used to stimulate the immune system to fight the HPV infection. surgical removal excision. In some cases, warts may need to be surgically removed by cutting them out. This is typically reserved for larger or persistent warts that have not responded to other treatments. Laser treatment. For larger or difficult to treat warts, laser treatment can be used to destroy the wart tissue. For verruca-specific treatments, cryotherapy. This is the most common treatment for verrucas, where liquid nitrogen is applied to freeze the wart tissue. Laser treatment. If cryotherapy doesn't work, laser treatments can be used to destroy verrucas. Minor surgery. For persistent verrucas, surgical removal may be required. Prevention of warts and verrucas. While it is difficult to completely prevent the spread of HPV, there are some steps that can reduce the risk of developing warts or verrucas. Avoid direct contact. Try to avoid direct skin-to-skin contact with someone who has warts or verrucas, especially on the face or genitals. Keep feet dry. Since verrucas are commonly spread in damp environments, e.g., public showers, swimming pools, it's important to keep your feet dry. Wearing flip-flops in communal areas can reduce the risk of getting verrucas. Good hygiene. Wash your hands regularly, particularly after touching public surfaces. Use separate towels to prevent spreading the virus. Cover existing warts. If you have a wart, keep it covered with a bandage to prevent the spread of HPV to others. When to see a doctor. You should consult a doctor or healthcare provider if the wart or verruca is causing significant pain or discomfort. The wart is growing rapidly or changes in appearance. You have warts or verrucas that don't respond to over-the-counter treatments. You develop general warts which require specific medical management. The wart or verruca is affecting the function of a body part, e.g., around the nails, causing difficulty moving. Conclusion: warts and verrucas are common, benign skin growths caused by HPV infection. Most warts and verrucas go away on their own over time, but they can be treated if they cause pain, discomfort, or cosmetic concerns. It's important to practice good hygiene and take precautions to avoid spreading HPV to others. If home treatments don't work or if the warts are causing significant issues, seeing a healthcare provider can help you find a more effective treatment plan.